Do you know how to use Semmes-Weinstein monofilament on the diabetic foot? We'll tell you. Diabetic foot is one of the complications that has the greatest impact on people with diabetes mellitus because of its impact on quality of life and the risk of suffering an amputation. Early detection of diabetic neuropathy is associated with a reduction in the incidence of foot ulcers and amputations. Among the methods of detecting diabetic neuropathy is the evaluation of superficial sensitivity by using Semmes-Weinstein monofilament. Andres Roldan, advanced practitioners for complex chronic wounds in the Aljarafe district, North Seville, tells us how to use it.
Today I'm going to explain the use of the monofilament technique to rule out peripheral neuropathy in a diabetic's foot. Assessing the risk of developing a diabetic ulcer involves taking an anamnesis, making a ventular climate, assessing
or
the
presence of
on
deformities
the foot, and carry out neuropathic screening using the Siemens monofilament. The Semmes-Weinstein monofilament test evaluates pressure sensitivity and tactile sensitivity, what has been called protective sensitivity. It's about a nylon filament attached to a handle that bends at a constant pressure of 10 grams regardless of the force applied by the professional. What would be the rules to use this monofilament test?
Thanks for watching
The filament is applied perpendicular to the skin, and the pressure increases until the monofilament bends. That's when sensitivity is assessed. It should not be held for more than 1 or 2 seconds. It should be initially applied to the face or upper limbs of the person to demonstrate the sensation they should detect. The exploration should be done at 3 points of each foot. On the dorsal part of the first toe, the distal phalanx, and on the head of the first and fifth metatarsal. When there is hyperkeratosis, the filament will be applied to the surrounding area. The exploration will be repeated once we have completed the removal of the secayo. Each of these locations should be scored
with a
0 depending on whether the person is sensitive or not. The sum of the values gives the monofilament sensitivity index from 0 to 6.
During
In
the
movie,
class,
the patient needs to have their eyes closed, and the examiner should say, now I am going to place this device at different points on both feet and let me know
what
when
they feel or what it is.
patient on the foot, on diapotia, on which finger, on the sole, at the moment when the monofilament is applied. The question should be edited, the note now. At some point, the question has to be asked without supporting the monofilament. For people with any numb spot, you have to repeat the exploration on that spot at the end of the test. In terms of repeated exploration at 2 different times. If it is sensitive on the second occasion, that point is considered sensitive. For people with all sensitive points, it's enough to examine them just once. The International Epidiotic Group's risk stratification system establishes the screening frequency according to the risk category. Once a year, when there is no neuropathy or peripheral arterial disease. Every 6 months, when there is neuropathy or peripheral artery disease or deformity in the hair. Every 3 months, when neuropathy, arterial disease, or neuropathy deformity in the foot, or arterial disease plus foot deformity is added. And every month when a history of ulcer, previous amputation, or chronic kidney disease is added.